Makanyagude is one of the poorest districts, which has been selected by President Mandela when he got into office. So those were very needy district, so he identified them. So Amref did the same. So the three projects are the sexual and reproductive health, HCT, HIV, counseling and testing, THP, traditional health practitioners, a project whereby we are trying to skill the traditional health practitioners in working in collaboration with the clinics and the hospital in terms of referrals of the conditions like the TB and HIV. So we're empowering the traditional health practitioners.
Amref has trained me on HIV and AIDS, TB, sexually transmitted infections, leadership, prevention of mother-to-child transmission, fundraising, and proper hygiene. Through the Amref training, I now use one razor blade for one client, thereby protecting and preventing infections from one person to another. I was careless before I got training from Amref. After going through the training, I'm now able to refer my clients to health facilities.
South Africa is progressive in many ways, in its infrastructure, especially IT, transportation and all that. But I can tell you there are still so many communities in South Africa that are in dire need of assistance by NGOs like Amref, like many other of these people working in the development sector.
Amref trained me on cleanliness, identifying signs and symptoms of tuberculosis and HIV/AIDS. Amref taught me about referring TB and HIV clients to the clinics and hospitals and detecting defaulters. Amref taught me how to work with clients and to provide home-based care. Many people are now benefiting from my home-based care training that I received from Amref.
Amref really winner. Amref really winner. Really winner. Amref. 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 Really winner. Amref.
A very strong monitoring plan where they develop the tools to monitor their interventions. Monitoring and continuous engagement with the service provider is very crucial to the learning of the institution that will remain with the skills and the capacity once Amref is gone. The very same project that we are working on right now. It's about 2 months having engaged with the Amref, but what I've learned is that we did not know much about youth-friendly services. When they came in, you find that they have researched about the project and see where is their niche, where can they fit in with their services. Before they put in any service provider to assist you, technically assist you, they bring a person that knows the story as much as possible.
My name is Nontohozo. My name is Butilis.
My name is Tobile. My surname is Bia. I come from Opondweni area. I am doing grade 6 at Opondweni Primary School.
The project teaches us about HIV and how we should behave, the use of condoms, and the use of gloves when handling HIV-positive people. Now we can relate better with HIV-positive people. The project has taught us about youth problems and about our sexuality and how we should behave.
Amref has sponsored the youth-friendly services in the community. The youth have been trained through football to access health services in clinics.
So far, to be true, not yet much improvement. Though we got an increase in the youth that is coming, but mostly it's the boys who is due to MMC. But the girls are not coming, it's just like before. The challenges that we are foreseeing is the staffing. Because as far as we would like to implement everything, but we are short-staffed at the moment.
Current project in the Jazini vicinity is partnership with Amref and also Opendweni Youth Development Initiative and ourselves. And the tri-partnership, we're looking to increase the uptake of health services at the local clinics for adolescents. That's the aim of the project, and Amref have kindly come into the equation and are helping us fund the activities that we're doing.
We educate clients to use condoms. Working with Amref has helped us to collect and collate HIV counseling and testing statistics through the use of tally sheets. The tally sheets help us to provide monthly statistics to the District Health Office and to Amref. More young people and adult clients are now coming for HIV counseling and testing. Defaulters become a big challenge when they do not collect their HIV medicine and we cannot trace them.
Our project is mainly to strengthen the health system, and especially with our project, you want to make sure that clients do access TB and HIV services. And of course, they go to primary health care facilities. Though it's a Visit TB project, but we want to go comprehensively. Our mandate is mainly to see health professionals because we are directly involved with health professionals and community health care workers. The community component is very important. Hence, we have revived the clinic committee so that the clinic committee is a link between the community and the clinic.
As a clinic supervisor, I have to visit this clinic, but due to transport constraints, that is not possible. But with the aid of Amref, we are able to have a transport and visit our clinics for clinic supervision. With e-visit testing rate, when Amref arrived here, we were very, very low. But as I speak now, we are at 93% plus. And we are the highest, I'm proud to say we are the highest sub-district with such a testing rate.
The lay councillors, they are helping us a lot. And they were also trained by Amref on VCT. The community health workers, they are helping us in tracing the clients because some of them, they tend not to come back if they have tested. So we send our community health workers to trace those clients.
Really winner, Amref. 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 Really winner, Amref.
The objective of the project is to reduce the child mortality and morbidity with the focus on children under 5 in one of the sub-districts called Makudutamaga municipality in rural South Africa. The project was informed by the fact that children around Makudutamaga were dying due to some treatable and preventable illnesses like pneumonia, diarrhea and malaria. Therefore, Amref South Africa, with the help from Amref UK, got a funding from UBS Optimus Foundation to implement the child survival program. Then we also have people from the Department of Home Affairs, Water Affairs, and the municipality. The main purpose for the project steering committee is to close the gap between the health facility and the community. Hence, I said we were using the community IMCI approach to address child mortality.
Management of Childhood Illnesses project that we are funding for Amref, we think it lends itself very well to this kind of new way of doing things. So we are hoping that when this project comes to an end, it's not the end of our relationship with Amref. We're hoping that we could find other ways of working together, hopefully ways that can show that there's a relationship between research and actual implementation on the ground.
The Child Survival Project helps us, the community health workers, to know what to do when we go for home visits. The project has equipped us with training knowledge on community integrated management of childhood illnesses. Prior to the training, we were not knowledgeable in a number of things related to child health. The program is helping us to do our job in a smarter way. The program taught us about the importance of involving men in raising children and taking care of their wives, particularly when they are pregnant. Through key health family practices, the project has also taught us that fathers should also take their children to the clinics when they are sick.
The father must take the child to the clinic.
Through the home-based care services, the program has taught us the appropriate time to start feeding our children with solids and the importance of exclusive breastfeeding during the first 6 months. They also taught us on what types of food to give under 5-year-old children, both in the morning, afternoon, and in the evening. Amref's Child Survival Program is helpful for the under 5-year-old children in our area. Our knowledge for caring for these children was minimal, and through the program we have learnt the importance of showing love to our children. We also learnt the importance of how to feed our under 5-year-old children. We also learned the importance of appropriate feeding for our under 5-year-old children. The home-based care has also taught us about the management of diarrhea at home. It has also taught us about the importance of visiting antenatal clinics during the beginning of the pregnancies. This provides us with a chance to be scanned for diseases and to identify complications early. The program should continue because for most women, these things are just eye-openers. We have learned from our previous mistakes and we are now able to share or involve other mothers on how to take care of their children. We are also encouraging other mothers to join the monthly focus group discussions at the clinic. in order to share key family practices. Children's death cases in our area have reduced tremendously.
And what I like about Amref is that they don't sweep matters under the carpet. Things that they have scheduled to do in the way they plan their project, and they don't turn out the way they tell us. For example, they plan to have 10 CCFs, which is caregiver forums, and they ended up with 4. But they give reason why this is so. Other organizations that we work with, they don't tell you these things. If it's anything that deviates from what we agreed on, they just sweep it under the carpet, and if you are lucky, you discover, because you go and we monitor and we evaluate all our projects. If you are not lucky, they manage to cover it so well that you don't see. But what I like about Amref is their honesty and the dedication and passion of their team.
Mamina.